So, what is sarcoidosis, and specifically abdominal sarcoidosis? And what about the ultrasound machine? Have you ever heard about its principle and how does it works? So all of this and more, guys, all of this and more we're gonna have in this video. So bear with me till the end of this video so that you acquire for yourself and new information added to your knowledge. But first, did I tell you about myself? Did I introduce myself to you guys? No, but I introduce myself first to you. I am Abdulatef Ahmed Saleh Geri, a medical physics student, final year from School of Physics at University Science Malaysia. Now what are we waiting for? Let us head all together to the core, to the point of this video, which is about this application using this imaging modality called ultrasound in diagnosing a certain disease, which is the abdominal sarcoidosis. First, we will speak about the abdominal sarcoidosis. What is it? Where it happens in the body. So, what is sarcoidosis? Sarcoidosis is a granulomatous inflammation condition, a chronic type. Now, you may ask a question, which is a reasonable question if you ask it. How this condition, sarcoidosis, is different from other inflammation conditions? Well, this condition is characterized with a nodular lesion called granulomas. Granulomas is a grown of tiny collections of inflammation cells. These are full of macrophages. These macrophages are incapable of killing the irritant, the foreign bodies, and the bacteria that are invading the body. In other words, the immune system response to the irritant that are invading the body is fluid and damage it. Now we know what is sarcoidosis, but where this condition can happen? Virtually speaking, this condition, sarcoidosis, can affect any organ in the body. So no organ is spared from having this condition. But, however, it is highly and mostly occurred in the lungs. Here in this video, we are only interested in the sarcoidosis, this condition that happens at the abdominal region, liver, spleen, etc. How we can diagnose this disease in patients? Well, there are many techniques actually to diagnose this condition in patients. We can use the CT, we can use the conventional X-ray radiography, we can use also the MRI. Besides this, we have now a new emerging technique to diagnose this condition called ultrasound. The heart of most ultrasound systems use a device called transducer. This transducer uses an array of piezoelectric crystals. These piezoelectric crystals vibrate when there's an electric signal applied on them. They produce high sound frequency pressure waves. Also, this type of crystal can work in reverse. By means, it can produce electric signal when detecting high sound frequency pressure waves. Now, when this transducer directs the waves into the body, they pass right through the skin into the internal organ anatomy. As the waves encounter tissues with different characteristics and densities, they produce echoes that then they reflect to the piezoelectric crystals in the transducer. This happens more than 1,000 times a second. Returning echoes are then converting into electrical signals, and these electrical signals are then converting using the computer into point of brightness of image corresponding to the anatomic position and the strength of the reflecting echoes. The medical transducer contains a large array of crystals. This allows to make a series of image lines that together form a complete image frame called a sonogram. What if you want to display a real-time motion of the organs? This can be done by repeatedly activating the crystal so that a complete image frame is formed around 20 times per second so that the real motion is displayed. Now we know the principle behind the work of the ultrasound machine. In the case of diagnosing sarcoidosis in the abdominal region in patients, ultrasound machine can reveal for us a number of things that are signs of having this condition. For the liver, ultrasound machine can reveal for us hepatomegaly bright liver appearance. Hepatomegaly bright liver appearance. For the spleen, it can reveal for us hypovascular nodula of various sizes or non-specific enlargement of the spleen. Also, endoscopic ultrasound elastography can provide for us information about the rigidity of the sarcoidosis region at the abdominal region. If these signs are observed in the patient, laboratory tests such as blood test or biopsy are needed to confirm the case of having this condition, sarcoidosis, in this patient, because these signs are commonly observed also in other conditions. So these tests will confirm the case of having this condition. We can see clearly the great potential of using the ultrasound machine in diagnosing sarcoidosis in patients. But we want to know the reason behind why this modality is preferred over other modalities, imaging modalities like the conventional X-ray radiography or like the MRI or the CT scan. Specifically, we want to know the advantages of using ultrasound machine in diagnosing sarcoidosis in patients. First of all, the low cost of using this machine. It is inexpensive, it doesn't cost a lot of money. For the people can afford it. People can afford the bills of being diagnosed with this machine. Also, the medical institute can provide this machine with low cost. Secondly, the flexibility that this machine provides. Ultrasound test diagnosis can be performed even at bedside. Thirdly, the use of this machine provides a lot of comfort to the patient health, because the ionizing radiation are not involved in this process, comparing to the other modalities like X-ray or CT scan, which emit ionizing radiation that are hazardous to the patient health. But comparing it to the ultrasound no, emits a non-ionizing radiation which does not put the patient in a potential danger for his health. Lastly, the contrast agents that ultrasound use in their diagnosis have low risk of hypersensitivity, comparing it to the X-ray contrast agent or CT scan contrast agent or MRI contrast agents. Although the numerous advantages ultrasound machine has, still other imaging modalities like CT scan, MRI, X-ray radiography are preferred over the use of ultrasound machine in diagnosing abdominal sarcoidosis in patients in some cases, because ultrasound machine has some limits. First limit: conventional sonography ultrasound diagnosis is an operator dependent. This means that the results out from the ultrasound diagnosis will vary depending on the medical technologies used of the ultrasound. Second limit: the lower specificity this machine has. Ultrasound machine has high false positive rates in diagnosing abdominal sarcoidosis. This means that more people who are in fact do not have abdominal sarcoidosis are being told that they have it. Thirdly and lastly, the lower sensitivity this machine has. Ultrasound machine has high false negative rates. A sensitivity as a medical term means the ability to correctly identify the people who have the disease. This means that more people are wrongly diagnosed with free sarcoidosis. With that being said, I covered the core points of this application of using the ultrasound in diagnosing the abdominal sarcoidosis. If you want to get a more deep knowledge about this application in diagnosing the abdominal sarcoidosis, I advise you to check the list of the references that I provide at the end of this video. Finally, I deliver special thanks to those who are watching this video, and I hope we meet again inshallah in future videos, and goodbye. Assalamu alaikum.